initiatives that have been taken in Sindh on family planning and also on the integration with the health sector, which we have talked about earlier in practically every conference, the importance of the nexus between health sector services and the health of mothers and children and the adoption of family planning. She spoke also about incorporating IT and digital technology to bring greater efficiency, also about how the community-based workers service, lady health workers, community-based workers, etc., are furthering the access or enhancing the access right down to the families in the village. Our Minister from Punjab, Khwaja Imran Nazir Sahab, has also spoken about the importance of ensuring that the religious community is also supportive. आज हम सुबह से बहुत अहम स्पीकर्स को सुनते रहे हैं. इस वक्त तो ज़रा हॉल में अटेंडेंस थोड़ी सी कम हो गई है, लेकिन I want to appreciate everybody who's still here, because for them it still is an important enough subject to see it through the whole day. We've heard a lot of data. I will not talk about data any longer, because this session really is about how the provinces are implementing. What are the steps being taken at the level of the executive and administrative leadership, which is the secretaries from Punjab, Khyber Pakhtunkhwa, Gilgit-Baltistan, and AJK. To hear from them that how does this policy, the policy framework, and how do the province's priorities roll out in the initiatives and in more effective services. I think that's very critical. I would like also for our panelists to tie a little bit of the larger discussion to the thinking in the provinces. For example, today we've heard about the centrality of women to development. Center space for women in development. अगर आप अपने initiatives में कुछ इस पर भी तफसील से हमें बताएं. The second thing that we've heard today is that population and demography are two such complex notions. It's not just about fertility rates. It's not just about provision of more contraceptives. It is about intersectorality, about education, the rights of women, the rights to reproductive health care, the autonomy of women, women in the labor force, opportunities for that, economic empowerment of women, and also ensuring that the health of children and the education of children and the skilling of our youth is central, because all of these things affect how you deal with population issues. So मेरी आपसे गुजारिश है, we will start with Ms. Anila Mahfouz Durrani Sahiba from Khyber Pakhtunkhwa, and I would request you that if you can also tie your initiatives to the conceptual framework that today we have to focus upon the people who are there today, the children that are there today, the youth that is there today, because this demographic bulge is still going to go on into reproductive practices. अगर आप contraceptive rate भी बढ़ा दें और fertility rate को lower भी कर दें, लेकिन जो age structure है हमारे demographic profile का, उसमें बहुत सारे इतने young लोग हैं जो फिर भी अपनी families में they will continue to reproduce. Ms. Anila Durrani Sahiba.
Thank you very much, Ji. And I appreciate Dawn efforts for organizing this event and giving us this opportunity to speak on this very much important subject of the day. Why it is important for Pakistan? Because this is, we are signatory to SDGs. And Pakistan is the one of the, like, you know, on the very high, like 5th populous country in the world. We all know it. But as far as the provincial stance is concerned, so we have to look with a different kind of perspective for different provinces. Because the situation of KP, Khyber Pakhtunkhwa, the traditional society and our demographics is entirely different than Punjab and Sindh, whereas we are somehow, to a certain extent, closer to Balochistan. But we have to keep these dynamics in mind, and I feel that after devolution in 2011, we have progressed a lot, because at the moment our growth rate is comparatively with, to all the provinces, it's a little on the low side, it's 2.38. And then if you keep the situation, the conflict and the conflict situation and the terrorism situation and political kind of situations of the Khyber Pakhtunkhwa, it's different than the other part of Pakistan. So we have traditional society. That's why, my actual stance is to give you the holistic view of my terrain, of my area from where I'm coming. So this is family planning is not something which is easy. It is a challenge. So in that, in our capacity, we have tried to expand the service delivery network despite the terrorism situation, despite the militancy. We have established 260 family welfare centers in the settled districts, and about 120 additional centers being established in the merged districts. That's underway. So we have also 43 mobile service units which are delivering counseling, contraceptives, and referrals in remote and mountainous areas. Here there is another issue. Because of the cultural conditions, our women is not that empowered who can make a decision for about family planning. The most of the decisions are made by the male counterpart, and that's why we try to engage very successfully the elders, through our jirga systems, and we have also tried to use ulemas, and we engage them in different kind of counseling. And besides that, our another initiative is we have successfully trained about 1,000 service providers for all these counselings, for the family care, in which we have also trained doctors, these workers, as well as, though we still need a lot of training, still needed. But till the point that, as we mentioned, we are discussing, we have 4 regional training institutes. Recently, we have established one in Dera Ismail Khan, and then we have also tried to engage social, we have collaborated with FPAP, like Green Star, Jaipago, Pathfinder, risk consultants, who are really trying to strengthen our system and our services. So because social mobilization, youth outreach, and male engagement is very much required. One another thing which is from the point of and from the perspective of KP is that our youth, because we have 62% of population is youth, and therefore starting trainings for the youth is very important. I would like to mention one another program here which we have recently completed as a project, that is Adolescent and Sexual Reproductive Health project, which we successfully completed last year, and now we are taking these social mobilizers as well as psychologists on a regular basis. So these are few of the things which I wanted to share, and because we have CPR increased 42.8%, whereas our TFR is declined as per the previous record, and the population growth rate, as I mentioned earlier also, it is 2.38. So these are certain kind of things, and if you want, I can share more the major challenges and things.
Thank you very much, Ms. Anila. It's very good to hear from KP that several initiatives are being taken across the board, and I think that it is absolutely very clear that if provinces are in the driving seat, you definitely have more effective planning, better implementation, and now when provinces move to decentralize, down to the district level, it will become even more effective. So an overly centralized government of Pakistan sitting in Islamabad is not the right way to deliver effective, ground-based, close to the community solutions. And thank you very much for that. We know in KP this is a very difficult area that you have to negotiate. I'd like to request Mr. Javed Ali Manwa from Gilgit-Baltistan. We've heard a lot about how the education sector has done very well in Gilgit-Baltistan because of the focus on education and especially girls' education. Perhaps you can tie that in also to your points on family planning.